Nephrotic syndrome. So nephrotic syndrome, it is the measure of severity of proteinuria and associated with any form of glomerular disease. Diagnosis of nephrotic syndrome is not based on etiology. It occurs when proteinuria is so massive that liver not increase level of albumin to compensate for urinary loss of protein. The cause is not definitely known. Nephrotic syndrome is most commonly seen with diabetes and hypertension, and the other causes are like cancers. It is associated with membranous nephropathy, minimal change disease occur in children, and it is associated with AIDS like focal segmental glomerulonephritis. It is also associated with NSAIDs and autoimmune disease like SLE. So how it present? The major difference between a nephritic and the nephrotic syndrome is the amount of proteinuria. And the massive proteinuria can lead to edema. That is characteristic is periorbital edema. And the one thing is that edema in congestive heart failure is dependent in dependent areas like legs. And in the nephrotic syndrome, edema can occur everywhere in the body. And the second thing is hyperlipidemia. And the third thing is thrombosis can occur in nephrotic syndrome due to urinary loss of natural anticoagulants like protein C, protein S, and antithrombin. And there is also element of infections due to urinary loss of immunoglobulins and the complement system. And by definition, nephrotic syndrome is hyperproteinuria that is more than 3.5 gram in 24 hours, and hypoproteinemia, hyperlipidemia, and edema. So how we diagnose the nephrotic syndrome? The first thing is the clinical presentation, like on edema, thrombosis, and the on lab investigation. The most and the best initial diagnostic test is urine albumin to creatinine ratio. It is equal in accuracy to a 24-hour urine but is much easier to obtain. It gives a measure of the average protein produced over 24-hour time period. For example, if we get a ratio of 2:1 means 2 gram of proteins is excreted over 24-hour time period. If we get a ratio of 5:4, it means that protein is excreted 5 gram in 24 hours time period. And the most accurate test is renal biopsy. It helps to diagnose the different types of nephrotic syndrome. Although each type of nephrotic syndrome has certain association that only a biopsy can distinguish between the forms. There is many different types of nephrotic syndrome like focal segmental membranous, membranoproliferative, minimal chain disease, and meningeal. And urinary albumin shows Maltese crosses that is seen in hyperlipidemia. What is Maltese crosses? These are lipid deposits in the slough of renal tubular cells. Lipids arise because the lipoprotein signal that turn off the production of circulating lipids are now lost in the urine. Hyperlipidemia is due to loss of lipoprotein signals. Lipoprotein signals. And the urinary shows Maltese crosses which are lipid deposit in slough of and tubular cells. So how can we diagnose? Urine AC ratio, renal biopsy is the most accurate, and in the urinary albumin it shows Maltese crosses. So next step is the treatment of nephrotic syndrome. First of all, go with the glucocorticoid steroids. If no response after several weeks, then try another immunosuppressant like cyclophosphamide. And AC inhibitors or angiotensin receptor blockers are also used to control proteinuria, salt restriction, diuretics for edema, and statins to manage the hyperlipidemia. That's it with the nephrotic syndrome.